which of the following medications is most appropriate to manage this patient's symptoms? 45-year-old woman presented to the emergency room department with tremors, anxiety, palpitations. She reports she recently stopped taking her prescribed alprazolam, which she's been using for the past 3 years. Blood pressure is elevated, heart rate is 110 beats per minute. Okay. I mean, it seems like she's having an anxiety attack, or also could be something with thyroid, but they're not mentioning any of the thyroid issues. Stop taking benzodiazepine. I'm wondering why they're putting long acting.
So what is the diagnosis you'd have?
I think she's having either a panic attack, or she's like a panic disorder. The thing is, if it's just an anxiety disorder, it's SSRIs. But I don't think it's that. She's been on alprazolam for 3 years.
So I want you to cause and effect for me for this question, right? You
Okay.
get what I mean by cause and effect. So you got a 45-year-old woman. She comes to the ER with tremors, anxiety, palpitations. She reports that she recently stopped taking her alazopram, which she's been using for 3 years. Now
Okay.
her blood pressure is elevated, her heart rate's increased. What do you think the diagnosis is? What was the cause of all these symptoms?
I think I was thinking thyroid. I'm just like, they're not mentioning anything about thyroid.
So I guess
Um,
my question is why do you think it's thyroid?
because she's having
So remember,
palpitations.
my
Could
key
just
thing
be
is what
anxiety. Okay.
changed, right? Clinically, what changed with this patient?
Stop taking benzodiazepine.
Okay, so the diagnosis has to deal with something with that, right?
Okay. Okay.
Because you're looking elsewhere, right? You're saying, oh, is it a
Yeah,
thyroid?
I'm trying to fit something into the box and it's not there.
Yeah, you gotta use only what they give you, right? And so the cause and effect here is she didn't have these symptoms and then she stopped taking alazopram. So what do you think is causing her symptoms?
Um, Not taking the alazopram.
Yeah, so what do you call that? When you're on a drug, then
Oh,
take.
it's just withdrawal. Oh, just
There we
withdrawal.
go. Does it make sense?
Okay. Okay. Okay.
Okay.
Okay. So then why would you give a long acting benzodiazepine then? Because it's just something she takes every day? Or it's not like an acute then it's not an acute panic disorder then. Okay.
So what do you think the answer is going to be here?
I think it has to be long acting benzodiazepine, but I don't know. I mean, it could be something. I'm just
Yeah,
gonna. Yeah. Okay.
yeah. So pretty much, right? What are fatal withdrawals? Do you know which medications?
Alcohol is for seizures, and benzos might be as well because
Yep.
they're depressants.
Yeah, but
Yeah.
remember they work almost exactly the same. They work on GABA, right?
Yes.
So
Yes.
benzos and alcohol are pretty fatal to withdraw from because your body you start having seizures, right? And so
Yes.
the treatment for like delirium tremors or benzo withdrawal is to give them, ironically, either alcohol or benzos and then slowly wean them off, right?
Okay.
Because in an acute setting, you can't have them withdraw because they can like actually die, right?
hmm
Flumazenil, that's a good one to remember because those are going to be overdoses.
That's the reversal of benzos, right? Yeah.
Yep. Antagonist, right? And that's gonna be a overdose of benzos, right?
Okay.
But you understand what I mean by cause and effect. You got to kind of look at
Yes.
what changed, right? Especially with these patients, with these with these questions, clinically, what changed. So